Good morning and welcome to our Global Healthcast special on COVID-19 in Pakistan. It is my great pleasure today that I can welcome the one and only expert on the topic, Professor Faisal Mahmood from the Aga Khan University in Pakistan. Good morning, Professor Faisal Mahmood.
Afternoon.
Professor Faisal Mahmood is Professor and Section Head of Infectious Diseases in the Department of Medicine, as well as the Associate Chief Medical Officer at the Aga Khan University Hospital for Infection Prevention and Control. Before the advent of SARS-CoV-2, he was heavily involved in HIV care, working with WHO. With the arrival of the pandemic, he was actively involved in working with both the federal and provincial governments, providing advice for risk mitigation. Professor Mahmood was the lead author of the National Guidelines for Management of COVID-19, and he contributed to several other guidance documents published by the NIH in Pakistan. At the same time, Professor Mahmood is an active clinician involved in several clinical trials, including COVID therapeutic and vaccine trials. For his services during COVID, Professor Mahmood was awarded the Presidential Civil Award. And again, without any further delay, it's a great pleasure to have you here and welcome again.
Thank you so much for having me.
Yeah. So let's start on COVID-19 in Pakistan. And the first question is always, what was the medical impact of COVID-19 in your country?
So as with all other countries, I think Pakistan was hit fairly hard with COVID-19. With us, because it's not a very widely traveled country, we actually saw our wave started a little later compared to the rest of the country, which gave us a little bit of a foresight of what we may be expecting. But nonetheless, as you remember, in those days, we knew little about the infection. The mortality was very high, and therefore it did impact our health system, especially both not just because of COVID-19, but also because of services being shunted from other essential medical services towards COVID-19.
So there was a big impact with regard to medical shortages, and how did that affect people? Can you give us a little bit more detailed information on morbidity, mortality, whatever you may have in your mind right now?
So interestingly, it's felt that our morbidity and mortality was actually lower compared to some of the other countries. Now, it's hard to tell, is this because of poor data recording? It's because obviously we don't have as robust a surveillance system in measuring who died and not. Also, there was a lot of fear around COVID-19 because of the quarantine, which I guess we'll speak about later, where people were hiding the diagnosis to some extent.
Oh, okay. Okay.
Yeah, but at the same time, we were also one of the very early adopters of using steroids in COVID-19, and this is because we had a lot of help initially from the Chinese who were using steroids much earlier in COVID, and that may have blunted our mortality to some extent.
Yeah. So as you were the author of national guidelines, what were the non-pharmaceutical interventions that you recommended? What were your countermeasures to the pandemic?
So our countermeasures, of course, kept modifying depending on how we were learning about the disease, and obviously very, very early on there was a lot of focus on travelers and people coming in. And our pandemic's been sort of interesting in that our initial cases were actually pilgrims coming back to the country from the different countries, and hence there was a lot of border control. But once we had the established infection over here, I think masking was one of the first things, and then obviously quarantine and lockdowns. As we learned more about the infection, and as our surveillance systems got better, the other NPIs we did was more of what we called smart lockdowns, where we were doing lockdowns only in areas where we were seeing cases. The country was divided into grids, essentially. And then eventually vaccinations came in, and that sort of changed the balance completely.
Yeah. You may remember that China was sort of very late with opening restrictions. How did you handle that? When did you reopen again? How long did you have the restrictions?
So our restrictions were fluid in the sense that, and like I said, our restrictions were really dependent initially on pilgrims coming back who were bringing in the infection. So they were really focused on those. In the first wave, our restrictions were really, really strict, but unfortunately, that did lead to a fair amount of economic burden. Because remember, in our country, many people live on daily wages. And so every day not working is a day that there's no food. And social support is relatively limited. So there was only a limited amount of how much restrictions we could put in. Also keep in mind that, it depended on which waves. We had almost 5 or 6 waves coming in. And the initial waves, it was, once the numbers would start coming down, we would open up and then we would re-restrict again. But we'd also have to look at things. So, for example, if it was coming during the harvest season, that would affect, harvesting and movement of crops that was coming. So it was actually, it's an easy question, but a difficult answer because it was really variable on the different waves.
But what I hear is you were very flexible.
Yes.
You did what was appropriate without or considering the harm that the actions would impact as well, right?
Absolutely. So we were looking at both the impact and also looking at the harm. The other thing to keep in mind is Pakistan geographically is divided into 5 provinces, of which 2 are really populous, where almost all the people live. And health in Pakistan is devolved. So in other words, the provinces are responsible for their own health. So each province was a little independent of what they were doing. And so there was also cross-border within the country movement restrictions to some extent. But yes, and each province looking at their rates and deciding, how much restrictions to put in.
Yeah. So we've spoken about the medical impact, the harm that was the cause that resulted from COVID-19. The question then would be, what was the negative impact of the quarantine during the pandemic? What were the negative effects that today that happened?
So I think of our negative impacts, I would probably divide this into medical and non-medical, I think. So amongst the medical negative impacts, I think some of the ones that really were impacted was our vaccination programs. A lot of children were not vaccinated. As you may know, Pakistan is one of the countries which has still has polio. So our polio campaigns were affected, not just because of lockdowns, but also a lot of the vaccination efforts were shunted towards COVID, which were being used in polio. In fact, if you look at our vaccination rates, you can see that for COVID, there would be dips whenever there would be a polio campaign. We have these national polio campaigns, vaccination campaigns. Patients were not able to get, during surges, patients were not able to get medical care because a lot of healthcare was again shunted towards COVID-19. And then things like our TB program took a hit, rates went up, HIV programs took a little bit of a hit because of it. In the non-medical, I think I already mentioned the economic impacts of COVID-19 with lack of imports coming in, the recession that we're still feeling from the waves of the past. We also had the daily wages, and there were some sort of risk mitigation put into place where there were government schemes that were started, but many people lost economic livelihood. And finally, education took a big hit. So that during those 2 years, a lot of children were doing schooling from home, and it really was not as impactful. So there's almost a 2-year gap in education, really, in some cases, some place. So those are some of the negative impacts that we're now realizing from all the lockdowns that happened.
That's a wide array of negative impact. So this is really quite impressive. Now, when did first vaccination start in your country, and which vaccines did you use, and how did it work?
Yeah, so our vaccination started about in end of 2021, and our initial vaccines actually were donated from China, and these were our inactivated vaccines that were coming in, Sinopharm and Sinovac. And they were, because we had limited vaccines, they were first given to healthcare workers, and then they were given to the elderly. And then as more and more vaccines came in, and as those people got saturated and more people got vaccinated, they kept opening up vaccination. So after at the same time, we also had a couple of vaccine trials ongoing. So people were getting vaccines from there. And we had a few people getting an adenovirus-based vaccine called CanSino, which a few people got. About a year in, we had access to the mRNA vaccines, and they were used either as primary vaccination, but very often as boosters. And again, the vaccines were given in the same way that it was first the vaccinator, the most vulnerable, and then we open it up. The vaccination campaign was actually very successful in many ways. I mean, this was something that we thought we could not do. Historically, we have a poor vaccine rate. We have a lot of vaccine hesitancy, but the government really was able to mobilize people to create these vaccine centers, get people vaccinated. And one other good thing is that a lot of so all Pakistanis have a national ID card, so that's our sort of a unique identification for us. And the vaccinations were linked to this. So you could just simply go online and put in your national ID card number, and you could generate a certificate showing what vaccines you got at any point with a picture and everything. So it was very easy for the government to track who got the vaccines and who has not gotten the vaccines. And there was a carrot and stick, and sometimes companies were able to sort of in some ways enforce vaccination to some extent, but almost all of it was actually voluntary. It wasn't like people were not caught on the streets to get the vaccine. So vaccination rates were pretty high, and it was easy for us to track it. The subsequent vaccinations then obviously dropped after that, and now we have actually no access to vaccines because we don't have any vaccines available, especially with the newer ones. So
that is sort of amazing. Number one, let me ask, do you have any number in mind on vaccine uptake during the early days or late days of the pandemic?
So it's hard to give a number because of two reasons. One is, like I said, the vaccines were not given to the entire population initially. It was a subset, so the denominator is difficult. So if you ask me what % of healthcare workers were vaccinated, it's hard to tell how many healthcare workers there are. But usually when we would hit about 70%, especially for the elderly, we would then move to sort of lower and lower ages until we got everybody, and eventually then the children once those became available.
Yeah, very interesting. And I'm very impressed as a German that you could handle the whole thing electronically. We have a hard time here for data protection for all stupid types of reasons, but that sounds like a very clever instrument, and you're far advanced with electronic data management in medicine then.
For COVID-19 we were, because that was a special circumstance, and this is one of the benefits also. So we talked about the negatives, but there are also many positives that came out of it. So it did help us develop more ICUs, get in more sort of ventilators in, really establish this COVID-19 surveillance system, which was not there. And what we did was we actually built up on our polio surveillance system, which a module was already there, and built up on it. So most COVID-19 tests were actually also linked to the NIC number. And hence it was easy for us to sort of figure out hotspots where people were. So yeah, I think this was a success story, and that's the positives where we can then try and build up on this for other infections now that COVID has sort of died down a bit.
Really excellent and very impressive. And look, as you were one of the leading persons for the countermeasures for against COVID-19 in Pakistan, what are your main learnings for the future pandemics? What do you think you would do differently next time?
So I think some of the positive learnings, I think, it's also important to focus on the positives. And I think one important thing what happened in COVID-19 is that the government very early on at all federal and national and provincial levels involved several of the infectious disease experts, which was one of the first time this had happened. So our health minister eventually was an infectious disease specialist who was brought in. Each of the provinces, most of the provinces actually had ID physicians also working with the epidemiologists. So it was actually, as opposed to technocrats or bureaucrats running the show. So that was actually a positive. And that's one learning also that we realized is for future pandemics, this is something that needs to be put in place. What was missing is the lack of pandemic preparedness. A lot of it was stitched together as we were going on. And maybe that's one thing we need to learn is pandemic preparedness, and also the importance of having surveillance systems in place before a pandemic happens. Based on these learnings, there are now, we're trying to establish better surveillance systems because of the COVID-19 pandemic.
Let me go back one question, and that is really interesting. You said that right now you don't have access to COVID vaccines. And in my view, there must be an overproduction and there must be too many vaccine doses out there. What am I missing here? Why don't you have access to vaccines in Pakistan?
Because vaccines that come to Pakistan are donated. Ironically, a lot of the mRNA vaccines that would come to us were the ones that would be closer to expiry. So countries which were not able to utilize it, they would send them over our way. And currently for the newer variant vaccines, we have sort of just a handful of vaccines available at the federal level. We had a sort of minor surge recently, and so there was thought of distributing these to the elderly. But now the question becomes, who should be getting these vaccines? But we don't, and these were never available commercially.
Very interesting. Yeah, thanks for highlighting this. Is there any last message on COVID-19 in Pakistan, something we did not cover and you think that is important not to be missed by the audience?
So I think, yeah, I think one thing that COVID-19 did bring up, and I touched on this very briefly, are the inequalities, not just within the country, but also between countries, where we were seeing, other countries having access to a lot of the sort of the healthcare, the pharmaceutical and non-pharmaceutical interventions, which trickled down here really late. And exactly what you said, at one end there was overproduction, but at the other end there was a deficit. So I think intra-country cooperation is something that is really key. The other thing is there was a lot of pushback from the population. Eventually, a lot of COVID, a lot of pandemic fatigue, and one thing that I think we could have handled better is communication at our end, and also continuing communication. People feel that COVID is gone, and we still have people in the hospital who are critically ill with COVID. But overall, I think as a country, if I was going to be in the middle of 2019 before the pandemic hit, and somebody told me a pandemic is coming, I would think that we would be in a really bad situation. I think overall, as a country, we actually didn't do too badly. So it was not a total disaster by any stretch of the imagination.
I'm very impressed by what you said, and thank you very much for your time, and I wish you a wonderful day.
Thank you so much, sir.